NGAA Research and Practice webinar for 2025. On behalf of the National Growth Areas Alliance, I'd like to acknowledge the traditional custodians of the lands on which we're all coming from and where we're meeting today, and pay my respects to elders past, present and emerging, and extend that respect to Aboriginal and Torres Strait Islander peoples present. This research and practice webinar is a first of a series, and my name is Anne Herney and I'm the Research and Policy Lead for the National Growth Areas Alliance, and I'd like to introduce you to Michelle Jack, our National Communications Coordinator, who's running the machine, which is great, thank you. Michelle, and Bronwyn Clark, our CEO, who I'd like to ask to just give a short introduction to our work for anybody who's not familiar with the National Growth Areas Alliance, and then I'll introduce our guest speakers after that. But on behalf of NGAA, thank you for your attendance today, and I hope you're finding it will find it very useful for your work. Thank you, Bronwyn.
Thanks, Anne. Thank you for that introduction, and we're really grateful to you for the leadership you took in pulling this project together and now disseminating it both through our policy and advocacy work and now through our membership. So the National Growth Areas Alliance represents local government in outer suburban areas. We have at the top of our pyramid advocacy to the federal government, and that is around infrastructure, community infrastructure, social infrastructure, planning and delivery. It's around population growth, it's around cities, it's around data collection, all of those issues that the federal government has an influence on. We try and make sure that they're thinking about growth areas from a local government and community perspective as they're developing their policies. We have, obviously, we're all waiting for the federal election to be called. And this piece of research that we did with the Australian Urban Observatory to highlight what's happening in every state capital city in the outer suburban areas is really vital to the messaging that we're putting forward quite successfully, I must say, in terms of the lag in community and social infrastructure. So what we'll do today is really run you through how it will work, but I'll hand over back to Anne to guide the speakers through that process. But in the meantime, we're really grateful to our members for being part of this. We hope that this is a tremendous value add to your membership, and it gives us that really important national story to tell, because sadly the infrastructure deficits that you all feel in your local government areas are shared right across growth areas across the country. So thank you for that, and please feel free to put any questions in the Q&A or in the chat, and we're always available, all three of us in the Secretariat, for any discussion points after this session as well. Hand back to you, Anne.
Thank you, Bronwyn, and thanks, Michelle, for that. If we can go to the next slide, please. Great. So as Bronwyn said, the work that we do in advocating for our growth areas is underpinned by research, and our purpose with these webinars is to provide insights to that research that underpins our advocacy, as well as to highlight the great examples of good practice that happens in our growth area councils by our members in applying research to tackle the challenges that we face as growth area councils. So in 1924, sorry about that. In 2024, last year, that's right, sometime last century, last year, we sought to collaborate with the Australian Urban Observatory to better understand the nature and extent of the disparities in access to key strategic and social infrastructure across our region that affects the livability of our areas. And today, for this webinar, we're pleased to introduce Bridget Papex, the Knowledge Broker and Partnerships Manager of the Australian Urban Observatory, who will explain and demonstrate the urban observatory platform and how you can gain insights on livability in your own areas. And then we're also very pleased to have Pietro Buccello, who's the coordinator of advocacy and economy at Cardinia Shire Council, who was an early adopter of livability indicators in their work. As Ronald mentioned, we're very open to your questions using the Q&A or the chat. We'll probably keep questions to the end of the presentations and we'll just see how we go. Bridget has also said she's available after this session because it is only an hour if there's people who want to have further insights into the platform. So that we thank you for being available for answering further questions if you want to, but of course you can also follow up through us. So without further ado, I'd like to introduce Bridget as she can ask her to share her screen. Bridget comes from an architectural and design background with 20 years experience in senior roles both locally and internationally. She, as the knowledge broker and partnerships manager for the Australian Urban Observatory, she leverages her extensive stakeholder management experience, design intelligence, and strategic creative thinking to bring the vision of the Urban Observatory to life as a tool for shaping our cities for the better. Bridget is thrilled to be studying a Master of Urban Planning and Environment at RMIT from within the Centre of Urban Research, where the observatory is based. This allows her to directly apply her academic knowledge to the role and leveraging the thinking of our broader research team to the benefit for Australian Urban Observatory partners. And I'd like to thank Bridget for coming on board and working with us on this research because we were under so much pressure in the lead up to the election, and we're very pleased with the result. So over to you, Bridget. Thank you.
Thanks, Anne. Well, I think the important thing is that the Australian Urban Observatory, which I'm going to tell you all a little bit about, give you the background and then jump in and show you the portal, is very much about impact, about maximum impact and maximum reach and maximum use. So anybody today can sign up to our portal and access a large amount of information that's free to the public. So I invite you all to do so. If you haven't, there's probably some seasoned users on the call, but for anybody who doesn't, you can certainly get in and explore yourself. And then further to that, there's the opportunity for a research partnership, which then I can explain a little bit about later on. So I will get started. And is that visible? Yep, all good. Okay, so I would like to acknowledge the people of the Woiwurrung and Boonwurrung language groups of the Eastern Kulin Nation on whose unceded lands the university conducts its business. The AUO acknowledges their traditional custodians of country throughout Australia and gratefully acknowledges their connection and care of land, sea and community. So in a nutshell, the Australian Urban Observatory is a groundbreaking digital planning platform that maps livability across the biggest cities in Australia, transforming complex urban data into maps that can be easily understood. The AUO indicators describe elements of an urban livability system that impact the health and wellbeing of communities. Our platform provides measured, place-based objective information about these livability domains and describes their interaction within an urban system, which is what you see there. The AUO's focus on the lived environment is a recognition that urban planners and their actions impact livability and public health outcomes, perhaps even more than public health practitioners. That's why the AUO is founded in the social determinants of health, because the conditions in which people are born, grow, live, work and age can lead to health inequities or unfair and avoidable differences in health and wellbeing. Understanding livability involves connecting the social determinants of health and wellbeing to urban planning policy and planning. By making this connection, the AUO connects indicators to purpose. So why indicators? Indicators are the tip of the iceberg. They point us and others to where we should look further. Our focus is indicators that are amenable to spatial analysis, particularly small area analysis. Mapping small area livability, that is the places where we spend our time, helps us understand communities to improve health. We map down to the ABS SA1 level of detail, which is approximately 400 people, to ensure that pockets of inequity are not hidden. The AUO's livability indicators are underpinned by years of policy-relevant urban research by RMIT University, research that connects the built environment with public health, social equity, and the UN Sustainable Development Goals, particularly number 11, which pertains to sustainable cities and communities. Our definition of livability, which can be a little bit different for each and every person, is safe, socially cohesive, inclusive, environmentally sustainable with affordable and diverse housing linked via public transport, walking and cycling infrastructure to employment, education, public open space, local shops, health and community services, and leisure and cultural opportunities. Everything that you see within the AUO when we refer to livability is underpinned by this particular definition. In the Australian Urban Observatory, we mapped 21 cities, 8 capital cities and 13 regional centres, because this accounts for 80% of the Australian population. We have scorecards that you can download on our website that give the city scorecards, which give a snapshot or a summary of each and every one of these cities within the AUO for 2021. And tell you exactly how they perform across the 9 domains of livability, which really helps you to understand perhaps where you're going, what you aspire to, or how you compare, and provides benchmarking. So we have 9 domains of livability, and under those 9 domains, there are 72 indicators. And we also map the ABS demographic information, which is really helpful to be able to understand who's living in a particular area and then cross-reference that with some of our indicators to see perhaps how they compare. A large portion of this information, as I mentioned, is free to access. So the city scorecards look like this. They have a summary on each and every page of the various domains of livability and how each city tracks with regards to those particular domains of livability. So what we did, the wonderful work we did with Anne and the NJA, was in fact to then say, well, if we were to look specifically at growth areas, how do they compare? Because the AUO scorecards, which present a summary of aggregated city level indicator results, were actually done to highlight inequity. And what they did reveal, even just in the city scorecards, was that in fact there's a wide variation across capital cities with a trend towards higher livability in the inner areas of each city and reduced livability in the outer areas. So Anne saw that particularly as an opportunity to really talk to what growth areas need and to particularly highlight where the challenges are. In the growth area scorecards, we narrowed it down to a set of indicators that we thought were particularly pertinent to the challenges that growth areas face. And you can see these here. They were social infrastructure across several domains: health, education, arts, community and sports facilities, walkability, public transport accessibility, access to public open space, and housing affordability. On the left-hand side, you can see, which is the last page of our summaries, it's got just a really quick snapshot showing you, in fact, that across most of those domains, the city of Perth growth areas fared worse than the non-growth areas. So each and every page, was unfortunately telling a story of a deficit in growth areas with the things that make areas really livable. And these can be downloaded. These can obviously be downloaded on our website under the impacts page. So these are the areas that were focused on. The 5 capital cities and their respective key growth areas were mapped. Those are the things you'll be able to see. And then did some work, particularly on looking at, well, what were each and every one of those indicators telling us. So just quickly, for example, livability, the information was telling us that Brisbane was lowest, and that the growth areas in Brisbane scored the lowest across all city regions. And then on the right-hand side, you can see some work that Anne's done in really looking at across the different cities, how did they compare, and then growth areas with non-growth areas. So it's about a visual, compelling story, but that's really anchored in data. So we work with quite a few, a large cross section of the Australian community at a state level, with LGAs, particularly Cardinia, who's going to follow me and talk now, with health, more and more health departments across New South Wales and Victoria in particular, the federal government, and even the private sector. So I might jump in and just quickly show you now just a little bit about how to use the portal. So just go back to Liveability. So when you log into the portal, you'll come up with a screen, and on the top right hand side you can type in, you've got an address search, you can put a very specific address, a suburb, an LGA, or you can simply zoom around the portal to find the area that you're interested in exploring. We have on the left-hand side the various domains of livability, and under that the indicators, so for example social infrastructure, and under that the subdomains of the various types of infrastructure that we're looking at. Under the address bar on the right-hand side you've got the geographical scales. So we map, we'll do Campbelltown, who I know are already pretty big users of the portal, LGA scale for social, cultural and leisure infrastructure, or down to the suburb scale where you start to see, so everything's aggregated up. So it starts at the mesh block level and then aggregated up. So, you might see an overall colour. As you go down to the different geographies, you start to understand what's contributing to that overall score. So a suburb level, and then right down to the neighbourhood level. And this is where you really start to understand what's going on in your area, who's faring well, who's not. And then you can ask yourself why. So it's that tip of the iceberg that points to things, to inequity. On the right-hand side, we've got the various timescales, 2018, 2021. You can do a comparison of 2018 to 2021, not for that particular one, which we don't have data for 2018 for that particular one. We are within the next month going to deploy 2024. So that will then give you an additional timescale to be able to compare. You can compare timescales side by side. You can also compare different indicators side by side for a same time period. So with the compare indicators, you can now also say, well, I'd like to look at livability as compares to some demographic data. So you can look at the two things side by side. Under that, we have a boundary. You can turn on, for example, LGA boundary, just to give you a bit of clarity as to the extent of your boundary. We can turn on all schools in proximity to where you are to understand the network of schools. We have a tool that measures walking distance over different time periods. You can choose, for example, you can set a time period, you can click set center, and then you can say, how far can I walk from a particular point in a 15-minute time frame, and not only how far can I walk, but on the right-hand side, what population resides within that. It's not as a crow flies, it's not a radius, it's an isochrome that actually tracks street intersections. So it's absolutely about what roads can I take to get to a certain point in a certain period of time. So that's clear. So understand, under that, you've got the scorecard and the information. So anything that you click on, the information then comes up on the right-hand side in the form of a scorecard. And so got that at LGA level, sorry, zoom out. This is telling me here that for livability, Campbelltown, is 98.4, which is just ever so slightly under the median of 100, but that overall it's in the top 21%. So that gives you the scorecard. Then down here you've got you can see how it ranks across all the different domains of livability, and that particular snapshot can be downloaded as a PDF. All of the information also up next to the indicators on the left-hand side can be downloaded from the download data button. You can download the data in CSV format. I think that's probably it. The other option, sorry, that I haven't told you is that you can also then turn on the satellite map underneath, which I find really interesting to look at parks, to sometimes understand how a community works, what, for example, Campbelltown, the extensive amount of bush that you wouldn't necessarily see from the other type of map. It shows you train lines and things like that as well that perhaps don't show up on the other type, of map. So I think that's probably a fair amount for the moment. I'll hand over now to Cardinia. Is that right, Anne?
No, that's okay. Thank you, Bridget. We've got time for a few questions if people have questions before we go to Pieta. I think there's a couple of things that I was thinking that are useful to know is that the website, or the question in my mind, so or good things to know is when you go to the website you can register, and you can register for free, and a lot of the data, as Bridget said, is available for free, so there's a lot of information there. When you download the data, it gives you for that city all of the but if you select suburbs, for example, it'll give you all the suburbs and all the indicators that are available for free. And then if you as a council interested in sort of being a partner, Bridget, you might want to talk about that at this point because that gives you access to some more information. And as Bridget said, there's 71 indicators in there, and not every indicator is fit for purpose depending on your area. So it is an opportunity to explore the list of indicators and think about your communities and what might be most relevant or not. And that's basically the approach we took when we looked at the growth area livability scorecards, which was what are the things that we thought would be most relevant for growth areas, and we did a bit more of the digging down in the social infrastructure. Bridget, I don't know if you want to just show where people can find because I think on your site the livability scorecards under impact is
which is not necessarily intuitive. You're right.
Yeah, yeah, you won't find them anywhere. We have them on our website as a link, but on it's slightly different way to access it on the Urban Observatory website. If you click on impact,
so you just actually click the tab rather than the drop down. It's actually just clicking the impact word.
The word impact. If you do that, and it should highlight. Did it come up? Yes, there we go. So there's more information about the livability scorecards, and then as you go down, so the map is showing the cities that the Urban Observatory information covers, but to get to our growth areas, you need to click on the capital city. So if we just click on Perth, yep, that's great, and then that gets you access to the actual scorecard itself, which is the PDF version where we've compiled the information for you. And probably if we just click through that to show the summary and how it's presented there. the different indicators, and we can see growth area councils are highlighted in the maps here, so that and the variation between the growth area councils and the rest of the city is what's calculated for us. So that's really, saves people a lot of time to be able to go just to those scorecards and get that information. And then so that's done for each of the key sets of data that we selected. You can manually do this if you wanted to for some of the other data that's available, but we felt that under the time and resources that we had, it was that selection. So, for example, under the sport and community and sport infrastructure, the indicators include access to things like libraries, swimming pools. Not libraries is under the cultural, but swimming pools and sporting fields. So sometimes it's a bit more collected, but councils themselves have some more specific data that you can then use this as your broader I suppose, summary of what's going on in your area and comparing to other areas, but then you use data that you have yourself to sort of really dig down in those smaller areas, as Bridget highlighted.
And we have a question from
Great.
James Marshall. His question is, can you please explain the definition of housing stress? Is this an indicator of affordability or more a general indicator of supply and demand?
Yes, so the actual definition of housing affordability, we use the indicator is the one where the I think it's the 40-40 or 40-30. The 40% of the households on the lowest 40% of household incomes pay more than 30% of their income on housing. And I think going back to that one, it combines the mortgage and rental. So we had to use there is data that separates rental affordability and mortgage affordability under the measures, but we in this case to get a broad view of housing affordability, we use the combined indicator. Let me just be sure about that. Yes, percentage of rental or mortgaged households in the bottom 40% of income spending more than 30% of an income on housing costs. And again, one of the on that website, to find out the details of how the indicator is measured, you use the metadata tab, if that's helpful. I'm just going to put in the chat my answer to that one. Chat's turned off on that one, but I'll put. I don't know how to reply to that in real time. Yep.
I've just got another question.
Here we go. Yeah, there's
interested to hear how the walkability measures deal with safe crossings. Is it able to model barrier of high-speed arterials on walkability, i.e. crossing from one side to another?
It doesn't focus particularly on that, but everything is not as a crow flies. It is taking into account that. So let's say I lived on one side of a freeway and I had a park on the other, but that the crossing was a kilometre down the road. That's exactly how it's mapped. So it's mapped on the access to a certain element, be it a activity centre or a school or a public open space. It's actually the pathway that I would have to walk and the intersections that I would have to go to be able to get there. It's absolutely not as a crow flies. So it is taking into consideration that particular constraint.
Thanks,
That's
Bridget.
good. That's great. Okay. And yes, we've linked and put the link in there for the Urban Observatory. That was a question from Bronwyn. And Michelle, if you wouldn't mind also putting the link in for the summary, our deficit to equity summary.
Absolutely.
One in there as well, because that also what we did with all of that information was just to see overall what the variation is in terms of each of those indicators, and Michelle has done a great summary document using that, and that's how we've used it as the NGAA. But now I'd like to introduce Pieta Bocello, who, as the coordinator of advocacy and economy in Cardinia, was, as I said, an early adopter of the use of the indicators, and has created a livability plan with it. So, and is, you know, well versed in using it. So, Pieta, if you'd like to share your screen, and I'll just say a little bit more about you. Pieta's been at Cardinia since 2016, and she led the development of the Shire's first livability plan, which is a public health and wellbeing plan integrating livability research conducted by what is now known as the Centre for Urban Research at RMIT. Being an early adopter of the livability research, embedding 7 livability domains into the public health plan framework and enhancing the link between neighbourhood livability, equity and population health outcomes. It's really great to have you, Pieta. So over to you. Thank you.
Thanks, Anne. Thanks for inviting me to present. I'd also probably just like to start and acknowledge that I'm joining you all today from the lands of the Bunurong peoples of the Kulin Nations, and I pay my respects to their elders, past, present and emerging. So I'm really happy to come and talk to you today a little bit about how we've partnered with the Urban Observatory over the years and used the indicators in our work. I'm probably going to take you back to a little bit of some of the history of where we sort of started and where we've got to now, because it's been a journey over more than 8 years actually, down this path to where we are now. So I just wanted to start by sharing, I guess, there was an initial report that came out back in 2015, I think, by it was a research group at Melbourne University at the time, which was How Livable is Melbourne, and this was back in 2015, and we were starting to think about planning for our new public health and wellbeing plan at this stage, and we really recognised that as a growth area, we needed to start thinking a bit bigger with our health and wellbeing plan in terms of how could we really influence health outcomes in our community. And we were seeing so much change in our demographics, in our communities, livability, that we heard about this research and we thought this is a really great opportunity to look at how do we embed this within our health and wellbeing plan and make sure that everyone understands that health and wellbeing is a priority for them and how their work can really influence that. So we started down this journey, and I'll probably just use the transport example because it links with a little example at the end of how we've had some success in our advocacy. But just to share that we did an extensive engagement process across our organisation to form our livability plan back in 2016-17, and we worked across all of the different departments of council to help them understand how their work impacted some of these livability domains, and then ultimately how that could influence health outcomes in our community. So just wanted to sort of share some of that history of how we've gone about it. You can actually read a bit more about it if you like. We worked with Melanie at the Centre for Urban Research to publish a case study about how we went about that. So I'm happy to share that if anyone's interested. And part of all of that work really accumulated into a bit of a logic model for us to really understand, okay, well, how does what we do in practice change livability and then ultimately impact health and wellbeing outcomes? I'm not expecting anyone to read that, and it's probably a little bit outdated now, but this was some work that we did to really conceptualise how we were going to enhance our work. And I'd probably just say that we also adopted a collective impact governance model for our plan at the time. So a lot of those sort of shorter term changes that we're working towards is things like increased advocacy, funding and resources aligned to these livability domains, etc. So there's quite a bit of work that went into not just the research, but the governance and how we worked collectively with our partners to implement our plan. So this is ultimately the framework that we ended up with. We identified 7 long-term health and wellbeing outcomes that we were working towards. For those that aren't in Victoria, we're required to develop our health and wellbeing plan every 4 years and to review that plan every 4 years. Our council adopted a 12-year health and wellbeing plan because we really wanted to demonstrate that you couldn't really see measurable change in some of these health outcomes within a 4-year period. So we wanted to look at how could we really measure some of those shorter term changes in livability that would ultimately lead, we hope, ultimately lead to some changes in those health and wellbeing outcomes. And we also embedded an equity lens, so looking at how do those conditions and as Bridget said, those social determinants of health, how are they distributed equitably or inequitably across our community as well. So yeah, this is, I guess, the overview of our framework. And then each domain, we have a bit more information in our plan about some of the key statistics. It has previously linked to Plan Melbourne. We're obviously going through our review at the moment, and it'll hopefully link to Plan Victoria as the new document. But really trying to show those links between some of the data, our policies and the state's policies. And each domain has a key strategic indicator that we report on, and we've used the data from the Urban Observatory to help us report that data back to council and the community and our partners. So in sort of reporting that, we have been doing an annual progress snapshot where we share some of the key stats. Some of it's not from the Urban Observatory, but a lot of it is in terms of those livability domains. We also use sort of the ABS data as well. So yeah, we undertake this annual report every year. So that's how it's really helped us to work with, I guess, sharing with our councillors and our community how livability can really impact health outcomes of our community. And particularly, I think, as a growth area, it's been really important to show, and you know, as the whole campaign for the federal election has shown, that inequity for people living in growth areas. And we know that there's a strong correlation between poor livability and poor health outcomes. So it has really assisted us in our advocacy in particular, and I think I'll probably just focus on that as an example given this group. But in the lead up to the state election, we did a lot of work to really understand some of the challenges for access to buses. So we, as a growth area, and particularly in some of our areas around Officer, hadn't seen any new bus services for 10 years, even though we'd seen substantial population growth. And we worked with the Urban Observatory to look at the data that was available and to build that into our advocacy campaign. So we set up our Better Buses package, and 2 of those new routes that we were advocating for were ultimately successful in advocacy. So we were really happy to see that we've got extensions to the services 928 and 925, which was for us a really big win. We hadn't seen, as I said, much of a change in bus services in that time. So I just wanted to share, yeah, some of the good news from that advocacy piece. There's so much, I guess, so much to this work that's been going on for, as I said, over 8 years. So I'm happy to answer questions that people might have in particular about, yeah, different elements of the work.
Thank you, Pieta. That's great, and it's really interesting to see that, you know, like that both the health monitoring as well as the underpinning for your advocacy. I think these tools are, you know, clearly, you know, really useful for both. And I think that as we get better at matching up what we do with what we and evaluation of what we do in terms of the outcomes we expect, I think they'll become more and more important. Michelle, are there any other questions? So we'll open that up to questions for Keta, but also any other questions for Bridget as well. Let's see. Having a little bit of trouble seeing. Well, I have a question for Pieta. Now that you're doing this on an annual basis, and have you, have you got some way of summarising some of those, positive impacts, where you've sort of like identified the gap, did something, and then measured it again to see the outcome? I mean, obviously the buses are good, but are there any people on the buses?
Yeah, that's a good question. We probably haven't gone to that level yet of evaluation. I think that the services only came online only earlier this year, or late last year. I guess because we've historically used and embedded the indicators in our public health planning, those in Victoria will know the sort of quite rigid requirements around how we've historically reported that. So all of our reporting has been incorporated into our annual reporting against our health and wellbeing plan. But we're now looking at how we further enhance and embed that into our advocacy plan as well. So we're still quite new, I think, in sort of having a really coordinated advocacy approach at Cardinia, and we're developing our first advocacy plan now. So we'll be looking to how we can really then start to align the council plan, our livability plan, and the advocacy plan together. And I think what we see is a lot of the evidence base for our advocacy sits really within our livability plan. And I guess the other thing that we use it for, not just for advocacy, but also in those funding applications. So where we've applied for funding for infrastructure or advocated for additional services, we've really drawn on that data as something really visual that really can, I think, speaks to politicians as well. We had another small win with our advocacy around mental health services. So we have a really big gap in mental health service access for our residents, and we presented some of the data from the Urban Observatory alongside some of the service access data, and we were successful in getting funding to plan for a mental health hub. So we're having some little wins. It's still early days, I think, in how we really integrate all of these pieces together. But a lot of what we've done historically has also been about upskilling our partners and making sure that they've got access to information that can support their work as well, because we know that for us, it's not just council that are responsible for influencing health and wellbeing. So we share this with our partnership group that includes, health services, our water authority, different philanthropic organisations. So we work really closely with them as well to share the data too. So
just on that point, Pieta, we've had a question come up from Jennifer saying, how are you finding the plan for coordinating work across departments?
Yes, it's been much better than previously when we had just the standalone sort of health and wellbeing plan that was the responsibility of the community services team. So I guess pre-2017, it was really just seen as a plan for the community services department, and no one else really believed that they had a role in improving health outcomes. But through that internal engagement, we did some this was a long time ago, 2017. We did some pre and post surveys at the time, and people really understood at the end of that consultation how their work influenced those livability domains, but then ultimately impacted health and wellbeing. I'd say it's not consistent at the moment. I think we've had some really good wins with some teams, and we've still got a bit of work to do with others. We have seen in the time since the livability plan was endorsed, we've now got an open space strategy that aligns to that open space and environment domain. We've got a food strategy that sits under our food domain. We've got a community infrastructure plan that sits up. So we're starting to now see some key strategic documents be developed that align to those different domains. But that's where a lot of the detail around what we're going to be doing and the initiatives sit. The livability plan is really seen more as like an outcomes framework. But what is that going to actually ultimately achieve for our community? So it's still a work in progress, I would say. It's, some really good wins in some areas we can still improve on.
That's great. Thanks, Peter. And this another question from James was, would you say, this is a question for both Bridget and Pieter, would you say it's possible to use the livability indicators to identify which areas are best placed to support increased housing density? And I might preface that by saying you mentioned open space, Pieter, and that's probably a really important one when it comes to increasing density. Overall, when we looked at the growth areas, access to open space was a positive for growth areas in comparison to some of the inner areas. So I guess it's my guess would be that, it's again looking at which indicators you would need to think about if you are intending to increase density. But I'm happy to have a comment from both of you on that one.
I'm probably happy to start, and probably should say the other strategy we have is our social affordable housing strategy that sits under that housing domain. But I think definitely there's some of the indicators are really useful in assisting in that work. I think it's I guess I've never used it as a single tool on its own for any decision that we're making. We've used it alongside other pieces of information and evidence. A piece of work that we did to develop a social housing strategy was to look at, we did some mapping of, I guess, some of the key criteria of where would we want to increase. So this is probably not specifically to housing density, but where would we want to see an increase in social and affordable housing, and what are the things that would, the key indicators that would make that a successful place. So it needed to be close to transport, it needed to be close to open space and services and things like that. So we did do some mapping to identify some areas that would be best for that housing, and we did use some of the Urban Observatory data, but we also used some other internal data that we had as well, and kind of made a decision that way. In terms of housing density, I don't know, Richard could talk more to that. There's so much change happening in Victoria at the moment.
all over.
I think it's certainly useful, but it's a bit chicken and egg. So you can look at an area and say, okay, great, those things are already there. Or on the flip side, if I was looking at in Victoria, the activity centres, when I was starting to have a poke around, okay, for example, the top 10 activity centres, where, what's there, I can see that there's the opportunity to say, well, actually, we're deciding that this train station and this industrial land around this train station is ripe. But then you can use the AUO to look at that and say, well, if I know that I need, these certain things, well, I'm also going to make sure that when I put my dense, like my higher rise buildings in there, I'm also going to put a maternal child health centre. I'm going to put a primary school, and I'm going to put a park, a small park, a parklet or something like that. So it's about either looking at something and saying, great, well, those things are already there. We're going to see if we can load in around that, or this would be a great spot for density because of its access to a train station. But we can see when we look at that area on the map that these things are missing. So we'll make sure that we advocate for or oblige a certain number of social infrastructure and or things that work into that to make sure that we're building livability into it at the same time, so that we're not covering. I mean, part of the thing that Anne's saying, public open space is a winner because developers are putting in parks and nothing else, and it's like, well, great, like there's parks, but is there anything around that park that I could walk to? Is there a shop there? Is there a hairdresser? Or what else is there? So yeah, interestingly, there's space for parks, but what else? You know, that park in and of itself is not enough.
Sure. And a question from Bronwyn, then in terms of trying to identify, you know, what are the data and indicator needs that you have, could you both talk about the process of working together from a council, you know, with Urban Observatory and vice versa, Bridget, you know, working with councils, the process of working together and to ensure that the data specifically meets, you know, the council needs?
Well, I haven't been working with the AUO all that long, so Pieter's probably got pre-existing relationships that she's been working with. But I think that the important thing is that your intricate knowledge of place is very different from ours, and so by getting in there and looking at the data and often extracting it and using it in your own dashboards and as Pieter mentioned, combining it with other stuff, that's a very common way of doing it. So Knox, who's one of our big users, they extract the information and then put it into their own dashboards or sort of translate it in their own way and combine it with some other stuff that they've got access to. So that's very common. But one of the other things that's also really helpful is the conversation we have around you know, when a query arises about something that appears to be an anomaly or something that people don't understand, that helps us to get in and explore it and understand why it's showing up in a certain way, and or even sometimes tweak our code so that, you know, things are actually showing up in a slightly different way, or we're changing our measure ever so slightly so that it aligns better to the story that people want to tell, or their experience of what is actually happening in their neighbourhoods.
And I believe the walkability index, you know, there's a few different, you know, livability indexes around, and there's a few different, you know, but the walkability index was one that was, you know, designed specifically, as you said, to take into consideration, you know, the walking distance to places and that sort of thing. And I think, you know, so in some ways, I think it's about there's pieces of work that can be developed, you know, from the research point of view, but there's also the information from the councils, isn't there, that can be fed together and then actually build a better picture of what's going on. But Pieter, what would you say?
I mean, I would really echo what Richard said. All those things is, you know, we've had those opportunities over the years to have those conversations, which has been great. And I guess we were very fortunate because we've been working with the team before that Urban Observatory was even created. So we got to sort of test the beta version and have those conversations right at the start. And I think I can see, you know, over the years, we've also provided feedback on how the platform works, and a lot of those changes, it's completely different now to what it was when it was first launched. So I can see that a lot of the feedback's being taken on board and embedded into the platform, which is really great. But yeah, I mean, when we did our advocacy for the buses, we had conversations with the team about, well, there was a couple of little anomalies, as we just said, and we just questioned those, and we work through them and find those opportunities to strengthen the data. Yeah.
And Bridget, what would you say would be your next steps with the Urban Observatory? I know from our point of view at NGAA, we're working to get a, you know, more standardized definition of growth areas so that it pops up rather than has a geography, and we're keen to sort of work towards that, but I can see that there's, you know, quite a bit of potential there to further develop. So I guess I'm asking probably both in the last few minutes to talk a little bit about what you see as sort of, you know, what improvements can we make and you know, in the next steps.
Well, that was interesting what you wrote back to Melanie yesterday about, because Melanie's in Adelaide today, and in fact Greater Adelaide is going like to the border almost. It's extending out to very far. So we were the whole notion with the ABS of defining growth areas and a city boundary is certainly something that we're pretty passionate about supporting as well. But I think for us, it's we've got some new talent on board in a new data scientist who's looking at AI, further opportunities with AI. But we're sort of asking, okay, to what extent is firstly urban heat, obviously canopy coverage, which we're trying to get up as quickly as possible, because obviously that's something that everybody's keen to understand, and urban heat will almost be another domain within livability, because shade will be you know, shade and also, I guess, absorption of rainwater, integrated water management, you know, that sort of aspect of it will be important. So that's one that we want to look at. I guess climate resilience is, you know, is something of importance, but within the context of livability, obviously we don't want to move into a new domain, but deciding sort of what aspects of that, healthy aging and building in more things around perhaps indicators that talk perhaps to healthy aging. So that's certainly something that's Melanie's exploring at the moment. And then we are discussing future modelling. So if you were to do this, what would be the impact, and to what extent we could explore, you know, if you were to tweak one thing, what, you know, where would you get, in a crude way, and the most bang for your buck? You know, what's going to make the big what things are going to make the big difference?
Right. Yeah, more to explore. Pieta, what would you like to see?
Sorry, what would I like to see in terms of the platform or next steps? Good question. I mean, definitely the climate resilience indicators is something that's come up really frequently in our organisation as well. I think I've mentioned probably at a previous sort of NGA meeting, a big priority for us has also been around sort of food security, and as a growth area, we have a large proportion of our shire that's not urban and has the agricultural regions. So I think for us, understanding kind of food access within the growth area, that's not the standard sort of supermarkets as well, something that we're probably keen to explore further. But yeah, predominantly I think within the urban areas of the shire, it's that the climate resilience piece is absolutely critical for us.
So just sorry, from a food perspective, that's mapping food production and or access to healthy fresh food. So that might be not necessarily only locally produced, but like,
so we have, for a lot of our communities, their food access might be, like their closest food access point might be a farm gate, for example, as opposed to a supermarket. So, and we're looking at how we expand and support primary producers to sell local food, and increase access to healthy food for residents. So that's probably, and that's an area for our council that it's been a big priority for our councillors at the moment.
One we'll definitely be interested to explore more. Well, thank you both, Bridget and Pieta, and thank you for the people who stayed on to the very end. We've got a few people dropping out, so before we just finish up completely, I just want to thank you all for attending, let you know that we do have a little survey feedback form, and those people who nicked off early will get them in their mail inbox. We are having these as a series of webinars. I could say symposia, but it sounds like Harry Potter, so symposia fabulous, or I don't know. But anyway, we'll certainly take on board some of those suggestions about what next as well, and exploring those with you. If there are other questions or wanting to speak to Bridget for about your own councils and interest in having your own exploration with Urban Observatory, please stay on or get in touch directly through, you can contact us in GAA or to the Australian Urban Observatory, and I think we put in the link to Urban Observatory website in the chat. So thank you everyone once again, and hope it's been it's certainly been interesting from my point of view. I really appreciate your time. Thank you. Thanks, Michelle. Thank you, Bron.
Thank you.